Everyone, today is February 2nd, Groundhog's Day for 2017. Our own Punxsutawney Phil saw his shadow this morning, so that's 6 weeks more of winter, and that brings us up to March 16th. So if by March 16th we don't have spring weather, we're all going to take a trip to Punxsutawney. Let's do it. But anyway, thank you so much for joining in to our weekly ACA webinars. I trust that you find them informative and helpful as we transition from 8 years of our former administration to this new administration, and hopefully significant and good changes within the ACA law to help us and to also help the consumers. So fingers are crossed. New administration, they did have a Philadelphia GOP retreat. There was evidently a mole in the meeting, and what the mole is saying and people are reporting is that, pardon me, there were discussions and concerns about the quick push to repeal the ACA, noting concerns of not having enough time to prepare a replacement, of course, how to avoid further and deep damage to the health insurance market, and how to keep premiums affordable for the middle class. Also, how to avoid the political backlash by possibly defunding Planned Parenthood. So that's what the mole reported. I don't know that anything significant legislatively came out of it. I've not heard anything, but I do know that the carriers, pardon me, are looking for something. And there was a report yesterday that the insurance carriers are begging the administration to stabilize the health insurance market within the next 30 days because as it stands now, the carriers have to file for their plans for 2018 starting in April. And of course, with the cost share reductions and that piece of the puzzle being held up with federal funding to the carriers, rightfully so, the carriers are concerned about what that means when they file their plans. If the cost share reductions are not released or approved as the law may be intended, there's an estimate that premiums will rise another 15 to 20%. So again, a lot at stake here, a lot of moving parts, and I will keep you informed as I know things. Of course, Aetna just announced too that, and they're vacillating a little bit, but Aetna has said, well, one report said they're not going to offer plans in 2018, and one says that they're thinking about not offering plans in 2018. So again, lots of moving parts, lots of uncertainty, but we'll be here to help you through it. On to the next bullet point. This should look very familiar to you. Highmark, no short-term medical sales after 2/1. So if you've not gotten those Highmark short-term medical sales in, it's too late. I wanted to just, for a minute, if I can get to the screen, bring you up to our National General link, because if you appoint with National General for the short-term medical, it's all online, but they also have ancillary products, the accident and gap-type critical illness insurance, and it's all on one platform, one bill. If you contract with National General, you receive your own agent-specific link that you can send out to your insured clients so they can apply themselves. You can put it on your tagline on your emails, and you can put it obviously on any of your websites. But check it out. Go to our department's health plan options and quoting tools from our website, and you'll see the National General short-term medical quoting system. So it's an easy system to use. The rates are competitive. They have a guaranteed issue short-term medical. It doesn't cover pre-X as the standard short-term does not either. But again, it is something that you can make application for your clients even if they can't answer no to those traditional gatekeeper questions. So check out the link, and let me know if you want to get appointed. Cap Blue Cross groups. I mentioned this the last couple of weeks. We are going to strongly encourage our groups to complete the EGems paperwork. You would need 1 service agreement and 3 TPA agreements. The 3 TPA agreements would list the group itself, you as the agent, and then URL as the third. So this gives us all access to EGems that when an addition or a termination comes in, we can process it much easier. And the next bullet point, this one right here, new offering, benefit notice generator. I know my team thinks I'm geeking out, but I am so excited about this new tool. It's part of our HR 360 offering, and I'll show you some examples of it in a second. But what this does is, with a data collection booklet, it generates a benefits notice booklet for your HR directors of your groups to hand out when they're doing their onboarding of new employees. They can also give it to existing employees upon renewal. It generates all the group-specific benefit notices. There's a notice for the 1 to 19 market, the 20 to 49 market, and then the 50 plus. And again, it comes in a nice little booklet that's very specific to the group. It has the group's name, the group contact address, everything. So again, this is a complimentary offering. If you're doing your group health benefits through us, it's an awesome tool. If you want more information on it, let me know. I wanted to also bring your attention to the fact that for 2017, we created a new flyer. The benefits notice generator is not on there, but I did attach this in your control panel. Can't even talk. Just for your review, and wanted to just highlight a lot of these benefits that, again, you can promote as your value adds. If you are doing group health through URL Insurance Group, you can promote these offerings, again, as your value adds. HR 360, if you have clients that you want me to add to the HR 360 model, I'm happy to do that. Complimentary. Let's go down to complimentary SPD and POC creation. Again, this is complimentary to the agent partners that are doing group health with URL. You can promote it as your very own. This SPD creation will save your clients a potential $110 per day per employee per line of health and welfare benefit potential fine. So again, promote these for your group clients and gain more clients for yourself. Complimentary COBRA for groups of 20 plus. And it goes on and on. So these are all things that we're doing to support your sales. The one thing that is not added, again, is that benefits notice generator, but I'm super excited about it. So again, if you want more information on this or any of our offerings, just give me a call. I'm happy to take a few minutes and talk to you about them. On to the next bullet point. Just as an FYI, the Affordability Safe Harbor for 2017 is 9.69% of the W-2. In 16 it was 9.66. So to calculate affordability, and let's be clear, let's hope we don't have to do this anymore, but it is 9.69 of the lowest cost plan offered by the employer for the single only premium. It can't exceed 9.69% of the W-2 of the employees. The 1094 and 1095 reminders, employers that are filing by paper need to file no later than February 28th. For those filing electronically, no later than March 31st. However, employers must send to employees that have to be postmarked by March 2nd. So if you have any groups that are doing this, and I'm sure we all do, be mindful of those dates. Governor Wolf announced for the 2017-18 budget, they are pushing to combine 4 of the HHS agencies into one. I applaud that effort. Anything that consolidates and eliminates duplicative services, I think is good for the order for all of us. What that really means and how that will affect anything that we do on a day-to-day basis, I'm not sure yet, but again, wanted you to be aware of it. Next bullet point, Highmark, all regions, they have just come out with a fillable PDF for enrollment and change forms. These are on the resources on the portals. We will have this on our website very soon for your use. And a note, the last day of open enrollment was Tuesday, and this was for the individual segment. Was on Tuesday, the 31st, so that's over and done with. Now the SEP business starts, where if you have an individual, they have to have a qualifying event, and they have to provide proof of that qualifying event to be considered for coverage, both on and off marketplace. So again, be mindful of that if you are still supporting that segment of the business. Just a note, there was a lot of news about how the Obamacare, healthcare.gov got a lot more popular, and yes, there was indeed a surge after the election in enrollment. However, I would just like to note that 11.5 million of the expected 13.8 million signed up, so they're still 2.3 million below their goal. So it's not that popular. And that's it. That brings us up to the open forum. Hopefully, I've covered everything. Let me just make sure I check my notes. Yep, looks like everything's covered. So we're going to open it up now for questions. If you have questions, just raise your hand icon, or you can type it in on the question box. Looks like I have a few. Tracy said that she noticed that the open election period for 2008 is only going to be from November 1st till 12/15. That may very well be true as it is now, but you know, let's see if that changes. I imagine it probably will. Again, if the individual mandate goes away, then there's really no driving force for people to get coverage or not get coverage. I would still hope that they would have some sort of open enrollment period to mitigate any adverse selection, but again, that's all out there yet to be determined. Dave says, can we add EGems to existing CBC groups? Absolutely, David. I will send you the information, the paperwork. Tracy says, can I send her the benefit generator booklet? You bet, Tracy, I will do that. And you as well, Dave. No questions, only requests. And Erica says, the 1094 and 95s are only required for employers 50 plus, correct? No. It is required. Let me get my cheat sheet here. 1094 and 1095B must be completed by small group employers, which are employers with less than 50 full-time employees in the previous year. They have to file, let me say, 1095 and 1095-4B and 1095B must be completed by small group employers, those with less than 50. Okay, 1094C and 1095C must be completed by large employers with 50 plus more. Self-funded plan sponsors must complete the 1095B or 1095C even if they're not over 50. So certain circumstances, really just the self-funding would trigger the requirement for the employer. So Erica, if you have a group less than 50 and they're self-insured, yes, the employer has to do it. Nate says, how does penalty for not having insurance work if only one of two married adults chooses not to enroll? Is household income cut in half? Boy, Nate, I don't know. I know I asked this question before and I can't remember the answer. Let me do a little bit of research on that. because it is a household, it's a taxable household. Yeah, let me check on that and get some more information. I'll also follow up with everyone next week. Ann says, did I miss this? Is there still a penalty for 16? Absolutely, Ann. It didn't go away yet. It's just talked about going away. So, and I don't know if that penalty will be retroactive. Remember that the penalty that people will face in the individual market when they file their taxes in 2017 is for 2016 coverage year. So again, I'm not sure if that can be changed retroactively. You know, we'll figure it out. Does the carriers do the small groups? And Tracy, I'm going to have to follow up. I'm not sure what your question means. Oh, yes. Small group, fully insured, the carriers do the 1095Cs. Thank you, Tracy. And Margie, I think I answered that question. Fully insured, the carriers are doing the 1094, 95s, absolutely. HRA group plans would need to do the 1095 filing, correct. So I tell you what, next week I have a good tool, and it has a grid. I think it was put out by one of the carriers, and I'll make sure that I present that next week so we all have a better, at least a visual, so maybe that will answer some more questions. And that looks like it as far as the questions today. As always, I really appreciate you joining in, and we'll keep watching all these rapid changes and informing you on what you need to know, hopefully. And if you just remember that every Thursday I'll be here at 9:30 unless you hear otherwise, and I look forward to all of your questions, and thank you again for joining in. I wish all of you a wonderful snowy Groundhog's Day and a wonderful weekend. Enjoy. Bye-bye.